Many women suffer from uterine fibroids. These are non-cancerous growths in the uterus. Fibroids can cause pain, heavy bleeding, and other problems. For years, surgery was the main option. Women could have a hysterectomy, which is the removal of the uterus, or a myomectomy, which is the removal of the fibroids. Thankfully, there's now a less invasive choice, uterine artery embolization, or UAE. UAE is a minimally invasive procedure. It shrinks fibroids without major surgery. This means a shorter recovery time and fewer complications for women. UAE is a game changer. It offers women a safe and effective way to treat fibroids and regain their quality of life. Let's explore how UAE works and why it's becoming the preferred treatment option. Before undergoing UAE, a thorough evaluation is essential. This ensures the procedure is right for you. The evaluation starts with a review of your medical history. Your doctor will ask about your symptoms and any previous treatments. A physical exam is next. This allows the doctor to assess your general health. A gynecologic evaluation is also necessary. This focuses specifically on your reproductive health. An MRI is crucial for visualizing the fibroids. This imaging test provides detailed information about their size, location, and number. This comprehensive evaluation helps your doctor determine if UAE. The UAE procedure begins with sedation. This helps you relax and ensures your comfort throughout the process. A catheter, a thin tube, is then inserted into an artery in your groin. This is done using image guidance. Digital subtraction angiography, or DSA, is employed. This imaging technique allows the doctor to visualize the blood vessels. It helps them navigate the catheter to the uterine arteries that supply blood to the fibroids. This mapping phase is crucial for the next step embolization. Section 4. Shrinking fibroids. The embolization process. Once the catheter reaches the uterine arteries, the embolization process begins. Tiny particles called microspheres or trisacral gelatin are injected through the catheter. These particles block the blood flow to the fibroids. Cutting off the blood supply causes the fibroids to shrink. Over time, the fibroids will shrink significantly. This provides relief from the symptoms they were causing. The procedure is typically completed within a few hours. Afterward, you'll be monitored for a few hours to ensure everything is stable. Section 5. Recovery and beyond. What to expect after UAE. After UAE, most women experience significant improvement in their symptoms. Pain relief is often noticeable within days. Heavy bleeding gradually decreases over time. However, full recovery takes time. You may experience some side effects in the days following the procedure. These can include pelvic pain, cramping, and fatigue. These are normal reactions and usually subside within a week or two. Your doctor will provide pain medication and instructions for managing these side effects. Regular follow-up appointments are important. These allow your Section 6. UAE success stories, evidence and patient experiences. Clinical evidence overwhelmingly supports the effectiveness of UAE. Studies have shown that UAE is highly successful in shrinking fibroids. It also provides significant symptom relief. Patients report high satisfaction rates with the procedure. UAE offers several advantages over surgery. These include a shorter recovery time, less pain, and fewer complications. It also preserves the uterus, which is important for women who wish to have children. While UAE is generally safe, it's important to be aware of potential risks. These include infection,